Hello, everyone. Welcome, welcome. Happy to have you all here. Going to give it another minute as folks are trickling in. All righty, we are going to get started. Welcome, welcome everyone to the Building Momentum for Language Justice and Human Services, the kickoff of our webinar series, the first one of three. Just want to do a few housekeeping. Just want to mention a few housekeeping things. We have a chat feature. Please feel free to introduce yourself, use the chat to share any thoughts with everyone. There's also a Q&A box. Please, if there are any questions that come up for you as the webinar progresses, please put them in there. We'll have a Q&A at the end to cover any questions. So please feel free to drop your questions in the Q&A box. And also at the end of the webinar, we have the deck that we'll go through today. It will be shared at the end. So we'll dive right in. My name is Chioma Hellenstein, and I work on the National Partnerships team for the No Kid Hungry campaign at Share Our Strength. And I have the pleasure of leading the programmatic national work for our Immigrant Benefits Access Strategy. And I also have the pleasure of co-leading this project with my colleague, who you'll hear from in a bit, on the Share Our Strength side. And we are so thrilled to just introduce our organization and talk about why this work is so important to us and why we're investing. We know, if we could go to the next slide. Thank you. We know that 1 in 4 children in the United States live with at least one immigrant parent, many living in mixed status households. And that means that many of them are eligible for programs like SNAP, WIC, school meals. And as an organization, we are committed to supporting and ensuring that families have access to food and the programs, federal programs that they are eligible for. So we wanted to create a strategy around helping families, immigrant families, have better access. And we came up with this 4-pronged strategy around research, outreach and enrollment, communications, and partnerships. And this work absolutely could not be done without trusted, amazing partners like APHSA and others that you see listed here. We could not do this work without you all. So we are so happy to be in partnership with APHSA and you. We're truly invested into creating better access for immigrant communities. So very excited and thrilled to be a part of this webinar. I hope that you enjoy all that's to come as we go on, and I will pass the mic to Jess. Thank you.
Yoma, it's also been a pleasure to get to work with you as well. I will say, I'm Jess. Nice to meet you all. I lead our process innovation team at APHSA, and I have had the pleasure of co-leading this project from our end with my colleague, Alex, who will be giving the bulk of today's presentation. But just to orient folks who may not be familiar with APHSA, we're the American Public Human Services Association. We are a bipartisan member association representing human services agencies. And our mission is to advance the well-being of individuals, families, and communities nationwide by influencing modern approaches to sound policy, by building capacity for public agencies, and by connecting leaders to accelerate learning and generate practical solutions. So that's what we intend to do around language, and specifically in this project, the SNAP program, or Supplemental Nutrition Assistance Program. And then on the next slide, just real quick, we have a little bit more about us. So as for being a membership association, we represent leaders from state, county, and city human services agencies across the country. So that's probably who's mostly in your attendee company right now, is who we consider our members. If you fall into that category and you work in human services, welcome. And we partner with organizations like Share Our Strength for the collective impact of this work, bringing it a little broader. So yeah, I think with that, I'm going to pass it over to Miranda to give us a little project overview.
Thanks, Jess. Hi, everyone. My name's Miranda Lozon. I use she, her pronouns, and I'm the manager of benefits access here at Share Our Strength. We are so thrilled to kick off the first of our Building Momentum for Language Justice in Human Services webinar series, and thank you all so much for being here today. I'm going to give a brief overview of our project. In 2023, APHSA and Share Our Strength launched Improving Food and Nutrition Supports Through Language Justice, a national initiative aimed at improving access to food and nutrition programs for households with limited English proficiency, which you'll hear us refer to as LEP for the remainder of this webinar. This initiative focuses on ensuring equitable access to SNAP and other nutrition supports through culturally competent services, high-quality translations, and effective communication strategies. The ultimate goal of this project is to develop a comprehensive strategy to help state and local agencies improve SNAP outreach and enrollment for LEP communities. And our approach is to center the experiences and expertise of refugee and immigrant families by gathering input from nonprofits, human services agencies, and other community partners and community members. Some of our key activities have included advisory committees. We have one composed of community-based organizations and one composed of human services agency personnel. This includes SNAP directors and outreach administrators. We have also been conducting focus groups with trusted organizations, with LEP communities. Some of the focus groups that we have conducted include Ukrainian, French, and Spanish-speaking individuals, as well as AAPI partnerships. And the other core piece of this project is really to develop resources and provide technical assistance. So what that's looking like is peer-to-peer learning spaces, technical assistance, and tools for agencies and organizations. And this will include our learning modules that will come out at the end of this project. This also includes the webinar series that we're here for today, that will cover this winter and spring. And then we also had our in-person language justice workshop in December that these webinars are building off of. So with that, I'll pass it on to Alex, who will dig a little bit deeper into our learnings and findings.
Hello, everyone. Pleasure to be here with you. So as my colleagues described, this project really is intended to be a comprehensive overview of all the various different factors that intersect with language access. So that could be experiential factors, matters that affected experience in the country of origin prior to arrival within the US, as well as some of these systemic factors at play. So some of the learning objectives that we're hoping to address today include the importance of language access in human services, including its impact on equitable access to food and nutrition supports, expanding awareness of language access and experiential factors applicable to SNAP programs, and then identifying common challenges faced by agencies and community-based organizations in implementing language access strategies. So how did we surface this information? So a little bit of context as to how we further inquired into some of these matters and issues. We have already existing programming and supports for personnel engaging individuals with lived experience having migration. So that could be through agencies or partner CBOs. And as far as our broader membership, there are those that are deeply invested in this work and better understanding the systems that are set up to help support families recently upon arrival through the entire progression of their acclimation to the US environment. So given that connection that we have, we thought that we were very well positioned to explore some of the systemic interactions as well as some of the felt experiences that some of these communities engage and have to live through on a daily basis. So in terms of sequences, the project started with several listening sessions with agencies and then several separate listening sessions with partner CVOs where we were able to more specifically focus on the issues that were endemic to each, being able to look at systems, processes, and then also like really the workflows that informed some of the outputs that we considered to be the translations and the products of these systems and that through which we interface with these communities. So in order to better understand the intersection between several of these different types of entities, we had a combined listening session with all of these entities within the system, and then also interviews with people with lived experience in accessing programs. So we talked a little bit about the populations that were addressed in the scope of this project, but then we also convened an action lab of members and CBOs to be able to better look into their application in terms of defining better workflows and structures for future iterations on this work. So taking a step back, what are we addressing today in terms of language access? Well, it is very difficult to find a definition that encompasses both the humanistic elements of language access as well as some of the procedural aspects that really have to be considered in this work. So as far as governmental iterations on some sort of definition, we can take the Department of Justice work that has been done in terms of defining language access, and then also some of the projects and products that they have issued. Here, they define it according to their purposes, and so we took more of an adapted functional approach to adapting this definition to the work that we're talking about today. So they defined theirs as dedicated to breaking down the barriers that prevent linguistically marginalized communities and those with limited proficiency in English, including those who are deaf and hard of hearing, from reporting a crime, understanding the rights, and navigating court processes, and from other interactions with US Department of Justice. Obviously, that is very specific and tailored for their purposes. However, in terms of the work that we're doing, we really appreciated the focus on the rights and the processes that occur within this space. Really just wanting to amplify that it is more than just the products. It is more than just the systems that are being utilized to effectuate these translations and interpretations. We really do have to look at the experience components of this work. And so we adapted it to a more functional definition, which you see here. So who is affected by these issues? Language-based access barriers disproportionately impact Indigenous peoples, immigrants, persons with refugee status, and people with disabilities. So this would be logical, just kind of given that they come from an environment in which the dominant language is not that of English. They may be fully multilingual, they may be highly educated, but the very fact that they are within the US, not with underdeveloped skills within English, situates them at quite a disadvantage. But we do want to make clear that we are not talking about disabilities and language developmental issues, because those would be entirely separate. They deserve their own treatment, even though they do intersect with language justice issues. So looking at the scale of the national challenge, clearly there is a large volume of individuals who have limited English proficiency within the country. Immigration numbers have risen even from very high numbers starting in 2021, where we were able to identify 45.2 million immigrants within the context of the US, escalating through to 47.8 million. So we can see that there is a very high demand for improved services and improved accessibility, which speaks to a very, very large proportion of the US population in and of itself. So 40% of immigrant adults within the United States have limited English proficiency. And we can see the predominant groups that occupy some of this linguistic space. So that's Spanish, clearly of a very high proportion, Chinese, Vietnamese, Arabic, and Tagalog. However, there is a contingent that speaks languages which are less represented within our systems. So 23% of those speak languages other than English that are not already identified in this other group. So some of the challenges that we know exist in the environment, regardless of the immigration status, regardless of the experience that brought them to the US, is that there can be low socioeconomic levels in the new country, but also they can pre-exist prior to migration. So this would already have set them at educational disadvantages in the country of origin. However, upon arrival, some of these matters become much exacerbated. And then there are also existing malnutrition and health gaps. So one can have a readiness and a desire to engage systems, but if there is difficulty in physically accessing systems and being able to physically sustain conversations, in being able to have the resolution that you need to be able to get through some of the difficulties of these systems, those can actually confer an additional layer of disadvantage. So as mentioned, there can be health issues, but this also could relate to mental health issues. So we have to look at the whole complement of potential health difficulties and disparities that affect this population. And then as mentioned, many of the people that we would interface with have high educational level, but some do not. Sorry, going back. There's also a lack of information. So we are talking today about translations and interpretation. However, even just basic access to information about systems, how they operate, what the expectations of certain types of procedures are, those also present significant challenges for individuals who have limited English proficiency. And then also, if these systems are already so complex, we can imagine that it is multi-layered for families who have various types of status. So they're not navigating just one type of status, they're also navigating multiple types of status very often within one single household. And these different policies and eligibilities also can sometimes intersect, and they're frequently changing. Even if somebody has access to appropriate supports through a governmental program, there can also exist physical barriers such as food deserts, where food of the desired nature is not available or it's physically out of reach. So just given that, we have to also consider that there are lots of structural barriers, which we'll continue describing, that impact accessibility, even if you have the appropriate linguistic supports. And also large family or extended network sizes do have to be accounted for within our systems, because a lot of the family structures that pervade the types of societies from which these individuals would come really are not reflected in the paperwork, which can lead to a lot of downstream consequences and effects. So these family structures often do not account for kin. They do not account for extended reliance on relatives and community supports, and also not accounting for them within the forms can lead to vulnerabilities in the form of accusations of potential fraud and other issues. There's also difficulty in that some of these individuals, just by having gone through the process of migration, as well as the factors that compelled them to migration. Will have interacted with a variety of governmental systems, many of those within the US, many of those being out in the country of origin. However, many of these may have been highly exploitative and harmful, setting up legacies of distrust with some of our systems. So here are some of the logistical elements that we've discussed that can present barriers. So when individuals have access to support, they may be dependent on caseworkers who are already stretched thin, and they may be likely to have time-intensive jobs that do not allow for consistent and immediate access to communications during standard working hours. So this interplay between caseworkers who are highly stressed and they themselves being unable to access the time to navigate various phone calls and a lot of the procedural elements which we've discussed, that can lead to lapses in some of the basic communications and submissions and timely reporting that has to occur for effective case follow-through. There are also long wait times for efficient translation with risk of disconnection. So all of us have experienced this in our own daily lives. But if it already has taken an hour for somebody to achieve successful transfer to a competent interpreter, we can imagine that this introduces several further layers of complication because the person will have to restart that process very often several times over. And then also the food preferences, as mentioned, may not be fully reflected in the environment. So we need to be attuned to making sure that if we have systems with which we're connecting and in dialogue and that are helping to support these families, they need to lead to an outcome of access to the nutrition that is required for their standard diets, and that would help them feel like they are not having to compromise their nutritional quality, but also their value systems. Lack of transportation to follow up an in-person events when it is an option is also a significant challenge. And we know that transportation is an oft-repeated challenge within a variety of different access systems and access difficulties. So it is not specific to SNAP. However, it definitely pervades most of our systems, and we know it to be a standing inequity for a large portion of the low-income population. But just given the existing disparities, it has a substantial impact on those with limited English proficiency. There's also direct social exclusion, which heightens and exacerbates any existing disparities because otherwise they might be able to better rely on their networks, but just given the circumstances and social isolation, including perhaps housing that is very distant from other social centers, this can create significant challenges. And as mentioned, the difficulty in terms of overcoming psychological concerns and barriers regarding hesitancy around systems definitely plays into whether individuals feel ready to access systems or not. And then also poor experiences on the part of one member can also propagate and create community distrust. In terms of the language itself, there are poor quality translations that abound, unfortunately. So even when something is adequately translated, there may be sections that have significant deficiencies in terms of the grammatical structure, leaving out details and information, or there may be phrases that did not translate well into the final product, or there may be ambiguities within the text that create difficulty in really understanding the nature of what it is that's being discussed and the specifics that are required, the actions and procedural steps that are required to be able to get to the final goal of being able to access these services. As mentioned, there could be inaccuracies that lead to fraud accusation risks. So we have heard through our network that a variety of individuals have incorrectly understood questions and then also perhaps misconstrued the understanding of sharing meals or some of these other details. And they may not understand the importance of accuracy, which has led to enforcement concerns and then also some of these fraud investigations have also been potentially used as pretext for other immigration inquiries. There may also not be sufficient depth in terms of the content. So even if successfully translated, the depth to which some of these materials are translated is not adequate. So we hear a lot about wanting to reduce the complexity of materials. That really is a great goal, and definitely we should consider the educational level and look at it from a mass communications perspective. However, it may not be sufficient in terms of clarification of ambiguities. So we also need to equally invest in content that expands on some of these initial baseline understandings. There needs to be enough depth and resolution to the information to be able to better understand for those who are seeking more information. Sometimes information is buried deep within the resources. So a fully and accurately translated page is a wonderful resource. However, if it is buried several layers in, the person may not know that these items are available for them. So as mentioned, clarifications are difficult to come by. Even if they do access somebody who is proficient in their language, the person may not be prepared, both in terms of their language proficiency and full understanding of all the potential variability in terms of policy that they may need in order to better support the individual through to achieving services. And then also translations do not address literacy gaps. So there may be somebody who may have complete lack of familiarity, not just with a given language, but then also scripts in general. How do we support these individuals? So we have a variety of different systems who do address more comprehensive needs, but the level of investment in terms of support that is needed for individuals who lack any literacy at all is much higher. And then some languages may be unwritten or may be spoken by relatively fewer individuals. So this includes indigenous languages, but also languages that do not have a script. So it is a little bit more difficult to account for them within our various data systems and fact finding that would lead to proper design of programs. So here we have a discussion of threshold languages. Basically, once the proportion of a language exceeds a given number or ratio as compared to English language or whatever the dominant language is, that triggers certain policies and procedures. And so threshold languages can be variously defined in a variety of different places and for different programs. So we're just taking the basic concept of threshold languages here. Evaluations may not ask the questions that need to be asked. So if an instrument for gathering information is not properly structured to be able to capture the information, then the results might be biased towards other languages, or they might just not accurately reflect the environment at all. So, but when correctly structured, they may still follow processes that gather or receive information, excuse me. Sorry. That gather or receive information in a manner that does not allow for accurate aggregation of the information. So we've heard examples of the funneling of two different data systems, and then the data cannot be disambiguated at the end, just kind of based on the content that was received and how it was compiled, or that there are some sort of underlying incompatibilities within the various different systems that funnel into the aggregated data set. And then meeting only threshold languages excludes a significant portion of the population and decreases trust. So if one population sees disproportionate investments in another, granted, they are probably appreciative of the effort in terms of reaching out to different communities and helping to support them. However, it does decrease the sense of trust in a system, and they feel undervalued as a community. And the numbers may not be accurately counted, but this is, sorry, numbers may be accurately counted, but this is not sufficient for understanding the types of needs within a population. So we really need to further understand and disambiguate the difference between numbers in terms of the volume of need, but also the intensity of need, because you can have a small, relatively smaller population that has significantly higher needs as related to the largest of the groups that you're contending with. Interaction with disability can also render some of these issues more complex. So as mentioned, you can have disabilities and handicaps that add another dimension to the language issue. So some of these can be overcome through physical interface, where the person has more contextual elements to pull from in terms of better understanding the messaging. However, you may have to set up additional systems, or you may have to do additional recruitment to better understand how certain disabilities intersect with a given population's needs. So most of our systems would be well familiar with Title VI, which defines non-discrimination in terms of race, color, and national origin. So that would definitely come into play for language access concerns. But since that can be easily accessed, we're not really going to spend time on the nuances of that particular policy. Instead, we're going to look at what those regulations prohibit. So we would be looking at not denying an individual any service, financial aid, or other benefit, avoiding not providing any service, financial aid, or other benefit, which is different or provided differently than to others. Subjecting an individual to separate treatment in any way related to the receipt of any service, financial aid, or other benefit, restricting an individual in any way in the enjoyment of anything related to the receipt of any service, financial aid, or other benefit, treating an individual differently from others and determining whether the individual satisfies any admission, enrollment quota, eligibility, membership, or other requirement or condition which individuals must meet to be provided any service, financial aid, or other benefit. Denying an individual an opportunity to participate through the provision of services or opportunities which are different than afforded to others. Denying a person the opportunity to participate as a member of a planning or advisory body, which is an integral part of the program. So we see that these are stipulations that we already consider on a day-to-day basis for any population. We really want to continue to look at through this equity lens at a population that's already going to be significantly disadvantaged, and make sure that our processes and procedures don't leave vulnerabilities that don't adequately account for matters of race, color, and national origin, and then also as analyzed these various different factors. In terms of language access policy and how we've arrived at our increased understanding of how to better serve populations with limited English proficiency, some of the foundational elements are rooted in various different titles, namely Title VI. But then also there is an executive order which addresses improving access to services for persons with limited English proficiency. So these mandates were used as the inspiration for a report that was issued by OMB addressing access to services for persons with limited English proficiency. And then based on this report, the Department of Justice, in combination with some of the definitional work that we talked about a little bit earlier, also drafted a model for their own services in terms of appropriate services and how they were looking at their processes, which then was later borrowed by FDA. And then that came to really be kind of the predominant framework being used to define language access within FDA programs. So this is not the only sequence that we could point to, but it is one as defined within various governmental documents describing the evolution of how our governmental systems leading through to the FDA's understanding of these issues came to be. But if you want to, there's a variety of different existing working groups, existing documents, and policies, basically within the larger ecosystem of references. And one can spend considerable time really looking at the nuance and how some of these materials are interrelated. But for our purposes today, this is really how we came to understand how FDA defines its own policy. So we've discussed some of the existing challenges, but really what is the relevance of language itself to food access? It's a variety of interconnected issues, such as leading to decreased employment opportunities that then lead to financial instability and therefore impaired food access, difficulty communicating the exact nature and the urgency of needs, because you can have adequate access to the preponderance of your nutritional needs. However, if there's something that's not being met, for example, an urgent need for a baby formula that is compatible with your infant's needs, there might be a high degree of urgency beyond the very general nature of needing greater access to food, nutrition, calories, and so forth. There's also lack of familiarity with language, which leads to lack of familiarity with systems, and therefore fewer avenues for securing resources and engaging in self-advocacy. And then also an inability to complete timely applications, which can then be prejudicial for future applications. Disparities also exist between non-citizens and US born. So we've been addressing this, but the degree of need, I think, also needs to be highlighted, since even after adjusting for income, education, employment, and health insurance inequalities, this need remains elevated. And non-citizens had 1.28 times higher odds of food insecurity than US born citizens. Immigrants in the US 5 or less years were 145% more likely to be food insecure than US born families. So we can see also the immensity and then also intensity of the need, and also therefore the call to action in terms of improving our systems for better capturing the needs, and then also better following through on supporting access. Common structural barriers within SNAP specifically. So we've talked about the general data aggregation challenges, but then also the analytical challenges. The data has to be understood from the correct perspective, and you have to be able to filter for any sort of artifacts or other things that might skew the data. And that requires not just an understanding of data and processes themselves, but also the populations that you're addressing in order to have an accurate understanding and analysis. The forms are also highly complex. So if it would be complex and ambiguous for us as English speakers, then it would most certainly be very complex for those who are coming at it through all those various disadvantages that we have talked about. And then, so if you are having disadvantages already, there are multiple application phases to programs such as SNAP. So whatever is experienced at one point may change in nature, but there's likely to be various points of intersection with these services, meaning that it's not just overcoming barriers for one instance, it's multiple instances of needing to recruit community support, recruit translation, advocate, figure out transportation barriers. Whatever the logistical challenges were, they're likely to be repeated and or replaced by other ones at a different phase in the process. And they also require ongoing interaction. So the consistency of the relationships behind these supports need to be addressed as well. The programs also, as mentioned, do not really account for household structure properly and the nature of extended kin. So in terms of our consultations with the various different systems involved in this work, some of the consistent learnings that we've identified include a lack of training on experiences of and best practices for working with limited English proficiency individuals, especially those from foreign-born populations. There's also a lack of data on affected populations and associated service needs. There's insufficient staffing for the volume, complexity, and level of support needs. So we talked about how some of these factors can converge. Do you have the staffing and the man hours in order to be able to help compensate for some of these concerns? Then written content such as notices and websites, even when accurately translated, are difficult for applicants with limited English proficiency to understand. So again, this is very much contextual, not necessarily related to education or related to aptitude. This is really just a matter of context. Existing supports such as language lines may experience quality control issues. So one vendor is not necessarily the same as another, and one has to continuously assess and create feedback loops to better understand some of these systems and where there might be existing vulnerabilities in some of the services provided. Agency technology presents both significant opportunities and major barriers for individuals with limited English proficiency. So this includes online portal functionality in languages other than English. So definitely artificial intelligence, for example, would be a boon. Digital interfaces are also a boon, but if you do not have the adequate human resources to be able to control and address some of these processes, then you might be actually setting yourself up for greater challenges. So concurrently, there are opportunities. Wherever there's a challenge, there is an opportunity to invest further in systems and to continue to explore how not only can we support for the immediate needs, but build in long-term sustainable solutions to help increase equity within our systems. So that could include enhancing a broad understanding of program eligibility requirements pertaining to populations likely to have limited English proficiency, cultivating mutual support and responsiveness between community leaders, CBOs, and human service agencies. And then importantly, one of the issues that was raised by our various members is improving the training and hiring of multilingual staff. And this really needs to be ascertained not just by somebody volunteering that they are proficient in language, but also demonstrating it through examination or other rigorous processes to really make sure that the person is fluent enough, conversant enough, and then able to in real time better address the needs, highly complex needs of some of the individuals who are going to be approaching them over the course of service. Concurrently, there needs to be training and staff on how to work with populations likely to have limited English proficiency, particularly with consideration of how experiences may impact needs. So this goes beyond just the language proficiency, but is a more holistic approach to training staff in terms of understanding the intersection of some of the experiences that we've described with some of the systems and language concerns that we've also identified. It's recommended that agencies improve technological capabilities for translation and digital accessibility. We've come a long way in the last couple of decades. However, there's still significant room for improvement and just streamlining processes to ensure that a person that has limited English proficiency does not become stuck within a given process, because then that actually might require even further investment that might have been needed for non-digital systems, because they will have to advocate, explain where their case lies. So all of these other responsibilities that will then be put onto the shoulders of limited English proficient individuals to have to rectify the process. And then improving the data collection methodologies will lead to an enhanced understanding of the entire landscape of services and potential supports. In terms of developing better programming, this is something that we can, I think, talk about more in detail within further installments within the series, but there are existing documents and frameworks that suggest using a 4-factor analysis, which is a high-level analytical framework that can be applied to a variety of different situations, and it has made its way through lots of governmental systems through to the FDA. It has its strengths and it has its limitations. So it would advise looking at the number proportion of LEP persons served or encountered in the eligible service population, and then comparing that to the frequency with which LEP individuals come into contact with the programs, activities, and services provided. The nature and importance of the program, activity, or service provided by the program, and the resources available and cost to the recipient. So all of these, there are documents that specify a little bit more about each step, but in general, these are some of the overarching considerations that really need to be included within an initial analysis, and that is great, but there's other levels of investigation that really are necessary to be able to define what appropriate programming and interventions would look like. So the 4-factor analysis limitations include that, yes, it is a simple way to cover most essential bases from a scale assessment point of view. We're really talking about volume here, and it really is a helpful first pass and overview. However, it is not anywhere near sufficient for being able to determine what constitutes equitable service. And instead, one really, I think, has to invest more in speaking to community organizations to better understand the needs, the challenges, the communication preferences as well, because one population is not necessarily going to be equivalent to another. And then populations' relationships to helping organizations, which can be equally varied. So understanding this, as well as a variety of other factors, really is going to be critical to better mapping and understanding of how better service is going to be rendered. And then also some languages might not be recognized or may be miscategorized. So taking care to go out into the community and better surface information about some of those languages that may have been lumped into, say, for example, Spanish, when you have somebody who might be only marginally proficient in Spanish, but actually is a speaker of an indigenous language. So there's a variety of different circumstances in which these kinds of concerns can emerge. In terms of general best practices that we've surfaced through this project, we advocate for the training of the general workforce to be prepared to address issues wherever they arise, engaging in more dedicated planning for data collection, as well as outreach strategies to understand the needs in both quantitative and qualitative terms, and then also hiring specialist, examined, and certified multilingual staff for providing services, translation of materials, and quality checks. And also a very necessary component is general needs and process overviews. And then having quality reviewed digital interfaces that are other language accessible from the very first page, as well as a variety of non-digital avenues for engagement. Another strategy that you may consider is also mobile outreach to minimize the dependence on some of these translated materials, and then also the digital interfaces, since that way your personnel can reduce the transportation barrier, but also engage face-to-face with the individuals who really would prefer that mode of communication. Evaluation includes establishing systems to obtain continuous community feedback on outputs and services, such as quality, including verification of digital interface performance. And then, well, where relevant, supervisory structures need to have at least this level of expertise buried within them. Because if your staff is advocating for certain needs, or perhaps they need additional supports, the personnel that are embedded higher within the system need to be able to properly contextualize some of that information and make the best possible decision. So it is not just a matter of training frontline staff, it's also an investment in deep expertise within those that are better situated to understand the needs of the community. Any agency effort needs to be accompanied by barrier reduction strategies. So that could be transportation and a variety of other logistics, whether through governmental systems or through partnerships, as well as the creation of safe sites for any in-person activities. Because through some of our different consultations and conversations, there were times where most of the services and processes went well, but it required the individual to spend prolonged time in dark alleys, in cold environments, or a combination thereof. So also paying attention that the locations in which services are offered are safe and conducive to making people feel welcome. And then establishing regular check-ins with implementation and CBO partners is really, it's an already understood best practice, but that really did emerge as probably one of the most helpful strategies for helping to create more seamless services. Yeah, so that being said, there's a variety of different elements to consider, and we look forward to learning more from your experiences in both the provision of these services as well as the design of the systems that are meant to perform this outreach and then also help to better support families. Thank you so much.
Thank you. Oh, if we could go back to the last one. Thank you so much, Alex. That was an amazing overview of the learnings. And folks, we are now in the Q&A portion of the webinar. Please feel free to continue to drop questions in the Q&A chat box. Also want to encourage you to use the chat. Drop your questions in the Q&A box, and then in the chat box, I want to encourage you to share if a question resonates with you or if you have any personal experience or anecdote based on what was asked. But we'll dive into our first question. Thank you, Jess, for answering it as well. But also wanted to share or pose this to our panelists. The first one is, what is a threshold language? That was asked. What is a threshold language?
I can start on that one, and if anyone else wants to elaborate, but generally for government agencies, public agencies, that term refers to if there's a certain percentage, and the threshold that threshold refers to varies across the board, but if there's a certain percentage of folks who speak a language in your catchment or your geographical region area that meets your threshold, then that is a policy requiring you to make services more available to speakers of that language, such as through translation or interpretation services available. A really common one is Spanish, as you might imagine. But yeah, and this project has been really scoped at SNAP, so we were thinking closely with SNAP agencies about how they measure and deal with threshold languages and the policies around them. But yeah, anyone else want to chime in there?
I think there might have been a follow-up, the predominant language other than English.
So threshold languages, as Jess was mentioning, really are those that meet certain numbers, certain proportions, which will then trigger a variety of different requirements. So it depends what kind of system we're talking about. It may not necessarily be SNAP specific, as Jess was mentioning. However, in the context of this discussion, it would be those that rise to a level that the government recognizes as needing a certain level of supports. And that could usually involve, well, it will necessarily involve the translation of various different documents and also the provision of interpretation services, but it could also trigger the need for a variety of different kinds of supports that help complement those basic services.
Thanks, Alex. The other question that came through was, what is your experience when it comes to sign language outside of ASL?
I don't think that we would be the ones prepared to speak on that, but definitely it is an area that is receiving more enhancement because we have a lot of individuals within communities that come with a variety of different injuries and TBI, particularly those from conflict zones. So it is an active area of investigation and increasing investment. I would not say that I have too much interaction with signed languages specifically, but there are a variety of different systems and CBOs that are set up to help better support individuals with that high degree of intersectional needs. So it depends more on like the kind and the nature of disabilities. If they are those that are incurred in the process of conflict, probably your survivor of torture program may be well equipped, or they'll be able to connect you to other systems in the area able to support these individuals, or you can go to your I guess, nationality-specific organizations where they'll already likely be acquainted with the highest volume of that type of need. It may take going through a variety of different systems to find one that has that sort of support in place, but very likely it does exist. Just wouldn't be able to speak specifically on the signed portion of it.
Thanks so much, Alex. It says on one of the slides, it listed that translated websites can be difficult to understand due to context. Some websites have the option to choose your language. Is this in regards to the accessibility feature? Can you elaborate more?
Yes, so the contextual difficulties that were being described, I think that was more speaking to a person's preparedness and understanding of systems at large and how they interconnect. However, in terms of just the product itself, the translated materials, very often there's a high degree of investment in the translation, but the pages and links that one has to go through don't always receive the same attention. So a system can feel fully satisfied that they have addressed a specific need by translating them, but if they are not navigable, they're most likely not going to be easily accessible through a Google search. Therefore, it renders that content almost like not particularly useful. So just ensuring that from the beginning, you're able to guide and navigate somebody through the process, also providing some of this content and information upfront is very helpful. I think that there's an emphasis on a simplification of products. However, that's not always the best strategy because sometimes there does need to be some contextual information upfront.
Yeah, I'll also just elaborate that one of the specific stories we heard, I think it was during the language justice workshop in December, was in one of the SNAP application portals. There was a really well translated application and like information about the application in Spanish, but you actually had to navigate through several layers of English pages that were only in English in order to get there. And so that's an example of kind of that buried translated content. And then specifically to the toggle, something like a toggle for translation at the top of a website. This is probably all we're going to get to. I'm just noticing the time, but the quality matters of that. And one that can be built in is generally a Google Translate feature or something embedded. And what we've heard time and again from folks with limited English proficiency and from government agencies is just like the quality of translation services matters.
And the toggle would also generally mean that you're going through an automatic translation, which in itself is not best practice. When resources are extremely scarce and you've exhausted all other options, it may make sense, but just from a best practices point of view, it probably doesn't really fulfill what you're trying to get it to do.
Thank you all so much. I'm so sorry that we're running out of time. We will try our best to get these questions compiled and send over a Q&A list with the questions answered. Please feel free to drop any last minute questions. We'll try to get those answered as well. Thank you all so much for joining us. Big thanks to our panelists, APHSA, Alex, Jess, and Adrian. I know you're on. Thank you, Miranda, as well. And we hope that the learnings are insightful that you heard and even validating for some of the things that you're experiencing and hearing. Please stay engaged as we continue this series. It's 1 of 3, and we hope to see you at our next session in March. Have a great one, everyone. Thank you so much for being here.